Hi, I'm Ashley, and today I just want to talk to you about the key points and things that you want to keep in mind during pregnancy regarding hygiene. So, one of the first things that we think about is oral hygiene. That's not just important at any point in your life, but particularly during pregnancy because of the hormones and the things that are going on, the higher demands during pregnancy that your body has that do affect the teeth and the gums. And they can be early warning signs for other stuff going on, such as gestational diabetes, Alzheimer's, heart conditions, things like that, that we can get a jump on and be more proactive with the proper oral hygiene. So things that you want to make sure to keep in mind is that you want to brush at least twice a day, ideally floss once a day, and make sure that you don't skip appointments to the dentist. 2 times a year is pretty ideal. And hormones like relaxin can they relax your ligaments and everything, which is very helpful during childbirth, but it can make dental things pop up a little bit more too for you, like bleeding gums, loose feeling teeth. And that's all normal, but there are some signs that your dentist can pick up ahead of time, like I mentioned before, gestational diabetes, preeclampsia, those sorts of things that are pregnancy related, that they can find early on. So another thing to keep in mind is breast or chest hygiene. Not something that you really think of probably too often, but some of the things that you want to keep in mind as that tissue is growing through pregnancy, you want to make sure that you're wearing a bra that appropriately fits you, something that is supportive, ideally not with underwire, something that breathes, that allows your skin to breathe, so cotton. And anything that you're putting, particularly on your nipples and areola, you don't want to have it have any drying agents like alcohol. If you have leakage, which is called colostrum, that's a normal thing. Make sure that you immediately clean it and dry it with just water. Using, again, drying agents on that can create problems. And if you're having a lot of leakage, use an absorbent pad and keep it in there. Make sure that you change it out frequently and keep them dry from moisture, but also not using drying agents. And then when it comes to your genitals, it's not uncommon for some people to regularly douche. And this is a misconception because the vagina needs to have a particular balance of good bacteria to essentially self-clean. So when you're douching and using maybe medicated wipes, things like that, antiseptic or perfumed soaps, that can wipe away all of that good bacteria that's keeping the good bacteria in balance and that's keeping a proper pH because it needs to be on the acidic side away, which leaves you open to infections like yeast infection, bacterial vaginosis, or even STIs. So make sure that when you are washing, use gentle non-allergenic soaps and stay away from the harsh perfumes, soaps, and douching and medicated wipes. Another thing to keep in mind is just general hand washing and hygiene to keep yourself protected from upper respiratory infections and all kinds of other things out there that, and in a pregnancy state, your immune system is lowered naturally and you have more respiratory challenges. So, things to avoid is touching your face, your nose, your eyes after touching anything that is contaminated. So we're talking about, you know, caring for someone that's sick, coming into contact with, say like you're cleaning up after your cats or the dogs outside, touching animals, anything. And these days with COVID, keeping in mind if you go out in public, don't touch your face at all until you have washed your hands. If you have to sneeze or blow your nose or wipe your face in any way, wash your hands before and after that. Ideally, at least after. Obviously, you can't plan for it if you need to sneeze. But those are the main things that you want to really keep in mind when it comes to hygiene during pregnancy.